bringing us exactly 11 minutes after 9. And we get into a roundtable discussion this morning. Today, we're having a very important conversation. We're talking about something that many people do not understand, unfortunately. We're talking about autism spectrum disorder. And it's becoming quite visible in Ghana, yet many people, many families still, it is still surrounded by some confusion, some myths, and some silence. And, some people call it stubbornness, some people say slow development and all of that. But we're told that it requires a lot of understanding and not judgment. Today, we're having a conversation on that, what every Ghanaian should know about the autism spectrum disorder. And we're breaking all of them down right here on the show. What exactly it is, what are the early signs people miss, and why early support really matters. Now, my guests this morning are Dr. Richard Bright Daniel. He's a pediatrician at the Kolebu Teaching Hospital. He joins us over the phone lines. And I have in studio Grace Abbey Nkrumah. She's the CEO of Bright Steps International School, and she's an autism advocate. Also, Gifty Otri, she's an educational psychology specialist and also an autism advocate. And these are the three individuals I'm sitting with this morning. Ladies, you are in studio, so let me say hello to you first. Good morning.
Good morning.
I hope we are all doing well.
Very well, thank you.
Very well.
Great.
How about you?
Yeah, I'm well too, by God's grace. Good to see the two of you. And we have Doc over the phone lines. Hello, Doc. Good morning.
Hi, good morning, and good morning to the special guest in studio as well. Apologies, I couldn't make it in studio.
That's okay. No, that's no problem. All right, so let's get into our conversation this morning. We're talking about autism. Well, Doc, let me start with you, since you are already, you're on the field. When we talk about autism spectrum disorder, what are we really talking about? Hello?
Hi.
Yes.
Good morning. Yes. So good morning to us. We were saying that as once Hans Asperger mentioned, it seems that for all our sciences, all the success in the science and arts, without a dash of autism, it will not be enough. And to quote him, he says that it seems that for the sciences or for success in science or arts, a dash of autism is essential. What it means is that, it's not all negative, like sometimes we are made to believe. When we mention autism spectrum disorder, it denotes that it's a group, it's a spectrum, it's from, if you want, a 0 to 100. And it is a neurodevelopmental disorder, and it affects the way a child communicates. So these are the essential parts. The way the child communicates, the way this child interacts with his or her peers, and then the environment, and how all this affects the child's behavior. So we have concerns with communication, interaction, and behavior. So this in the essence of autism spectrum disorder.
All right, Doc. I think we're having some challenges with your connection, and so we'll try and fix that. Yes, but let me come in studio, and then we can continue. You have also been working with a lot of people. If you're maybe just your knowledge on what exactly a condition is about, how it even comes about, and all of that. I'll start with you, Gifty.
Okay.
Sorry, Grace.
Great.
Sorry.
All right. So yes, as Doc mentioned, it's a developmental disorder. Okay, and it impacts 3 areas of the child's life: the communication. So either there is no communication or delayed communication.
Right.
So they're communicating later than usual. And then the second aspect is the interaction. So how they interact with you and I socially. So they either eye contact or they're not responding to their name. They play on their own, etc. So you see that aspect as well. And then the third part is the behavior component whereby they are doing something repetitively. It could be that they're flapping their hands, or they're rocking up and down, or they are lining up toys on the floor, and so on. So usually you should see all the 3 for it to be categorized as autism. It's a broad spectrum disorder. So one child with autism is very different from another child with autism. Yeah.
What causes that?
For
Okay, I like
You
to
see,
add a
okay, you want to
little.
add a little to that before,
Yes,
right?
so
go ahead.
as my other teammates have mentioned, it has to do with a neurodevelopmental condition. It simply has to do with a different way of thinking,
Okay,
a different mind, a
right.
different perspective of seeing the world,
Mm.
away from our eyes that we normally see.
Mm.
Yes, so it's more or less like, as she's saying, it's characterized by the behavior, the interactions, and all. And then you asked about what caused
What
this.
causes
There's
that?
no known single cause for that.
Okay.
Yes, but then there are contributing factors.
Mm.
Yes, which I think doctor can help us more.
Mm.
We have the genetics, we have the biological. So I'll turn that to doctor to give us more insight on
right.
that.
So I'll come to Doc. I don't know why we're having that challenge this morning, but we'll fix that. I'm sure the producer is checking that behind the scenes. But maybe while we get into the before we get into the conversation proper, why did you get into the advocacy? Maybe I'd love to hear stories.
The story.
So yes, how did you get into the advocacy?
All right, thank you so much. After 20 plus years in the corporate world, I decided to venture into education, inclusive education.
Okay.
It's mainly as a result of my personal experience with my son. My son was born 15 years ago. Everything was normal.
Okay.
He was growing, catching up on his milestones, and then at age 1, we noticed he wasn't going past saying mama and dada, and that's it. He crawled quickly, stood up quickly, but he was not walking. So we started the search at that time. We had a lot of challenges here in Ghana, even though we're seeing the experts. We didn't get a diagnosis early. We were told, oh, he's an only child, he's a boy, let's give him some time. He wasn't showing all the symptoms, so we weren't giving him any kind of support. So it was much later, around the age of 4, in another country, that we got the diagnosis. So you can imagine we lost a lot of time. And then my company at the time was sending me to different countries, and we were exposed to different ways these countries are managing this condition and so on. So it's always been my prayer that when I get back to Ghana, I would set up a place that someone like me, those days, who is starting off with a child and has questions and wants an educational environment where the child could thrive, that they would find a place like that and bring their child in. So this is why I'm on this mission, because early intervention is key and it can change the trajectory of the child. But today in Ghana, we have a lag in the diagnosis process. So we're getting the diagnosis, but most of the time later. The children are coming in later. When the earlier, we know that the earlier they intervene, the better the outcome. So this is why we're on this.
Right. How about you,
Hi. Thank you. So I had a knack for teaching at a very early age. So after school, secondary school, when I entered into the informal teaching, I had lots of experiences. So there was one instance where a student came to school, a grade 2 student came to school when it was time for recess. I realized she took off her shoes and her socks were very clean, new. And then she just ran off to the playground. So I was quite curious as to why she would do that. I got close and I asked her, why are your shoes off? Is it tight or something? She's like, no. My mommy says when I come to school, I should dirty it. So I was like, why would a child think like that? Take the literal, translation to what the mother said.
Right.
So I had to find out why she's thinking that. And then that's when I got to know that, no, there are different minds who think literally. And this and that and that. So it got me curious to do lots of research. And even had to turn to going down to preschool level to learn a lot and help.
And that's why you decided to go on this journey. But how has the journey been so far for the both of you? I mean, in the work that you're doing? I mean, I love to hear these things because maybe there's somebody listening to us who also wants to get into some of these things, and it's very important. So let's talk about that for a few minutes while we also get Doc back, and then we can get into other parts of the conversation. How has it been for you?
It's been quite fulfilling. Yeah, at the end of the day, although sometimes progress might not be big, but then the little ones count. You know, this morning I was having an interaction with Madam Grace, and we were sharing quite some experiences, and I was telling her that one time I had to speak to a student on phone, although she's nonverbal.
Right.
For some reason, when I spoke to the mother, I told the mother to give the phone to her. And then what came out was a deep voice, hello.
Wow.
A 6-year-old who had never brought out words. I cried that day. I was at church. So it's the little work that you're putting in, little time you're spending day by day. We are in expectation of progress. And then as we move on, we realize that it comes. The communication does not come verbally sometimes, but there are other ways that they do communicate with us that at the end of the day you see that progress is made.
Right. Yeah. How about you, Grace?
For me, it's been fulfilling, life-changing, I would say. Because at Bright Steps, we've seen children come in who are non-verbal, who are not looking you in the eye, tippy-toeing, not potty trained, and within months, we see the children potty trained, beginning to make sound approximations, then to single words, and then to speaking in sentences, asking questions, and so on and so forth, right before our eyes. We've had some very, very miraculous cases where a child who was previously diagnosed with autism, after some period of therapy, we see it at our institution, but we actually get a pediatric neurologist writing to us to say that this child no longer requires therapy.
Wow.
For me, this is the ultimate.
Wow.
As a mom with a child with autism, I wish I had this for my son earlier on in life. So in terms of fulfilling, I think it's I was telling her in the morning that I feel like if God calls me today, I feel like my son's life benefited a number of children, and for me that makes me very, very happy.
Kudos to the two of you, and God bless you for the work you're doing. Yes, it's becoming an emotional moment. So let's move away from so that we can have our conversation this morning. All right, but why do you think so many people don't understand the whole thing? Why is it misunderstood? Is it because we are not doing a lot of education? Like, what exactly is the problem? Grace.
Okay, so for there are a number of reasons. One is the lack of education, but I think recently the awareness creation is really going on. And so over time we expect that we will bust this one easily. But there's also stigma that is, especially here in Ghana. When we don't understand something in Ghana, we give it a spiritual connotation. So a child with autism doesn't have a look. So I've seen situations when people are referring to children with cerebral
syndrome,
palsy or Down syndrome as children with autism. The difference for a child with autism is that the child has no look physically. The child looks perfect.
Yeah.
So you won't suspect anything.
So you can't. We don't understand why. Then is the child not communicating? Why then is the child having these weird behaviors? Why is the child not interacting? Then we go, okay, it's a spiritual reason, it's a curse, it's this and that. So for this special reason, we a lot of the times we see the children come in later because the parents are busy searching for the spiritual meaning of what's going on and trying to get answers elsewhere before actually accepting and bringing the children in for therapy.
So there are the deep cultural beliefs,
exactly,
and there's also the lack of awareness.
And
even
also,
though these days, okay, you want to say something?
And also, most the outsiders who attest to will query parents for bad parenting. Yes, so they will mostly say you've pampered your child. That's why they are acting this way, especially when the meltdowns happen. Yeah, so
what's that?
What we normally call the tantrums.
Okay.
Yes, we call it meltdowns. When their system gets so overwhelmed with lots of chaos around them, they tend to melt down or cry or do all sort of things to show you that I'm uncomfortable here, since they can't communicate the way you expect them to do. They could have done it, but you didn't notice. Yes, so when we see all that, we will link it to bad parenting. The child is spoiled. The child is over-pampered.
Okay.
That is why.
Right.
Yeah.
Because you talked about stigma. What are we getting wrong in how we describe these children? And maybe what are some of the things we used to describe them that we have to stop immediately?
Well, it depends on which part of Ghana you are from. I'm from the Upper East.
Okay.
And in my language, the child is considered a spirit child. The child is not human. So the child, because we don't understand what's going on. And the child has come in perfect human body, but not speaking. It's not human, even though he is human. So in the olden days, they would send off the child. So you, the mother, you'll be asleep. You wake up, your child is not with you because somebody has come, picked up your child, and gone to leave the child in the middle of the forest, all by himself. You can imagine what's going on. There are times they call the children all kinds of names. Insioba, Bosomba, all kinds of names. All these puts the fear of God in the parent. You know, even within the extended family, sometimes they say, oh, the child is over-pampered. It's an only child. It's only a day. You know, they have all these expressions. And it makes it very, very difficult for the parents with these children. And so recently, you would see, in fact, I think even recently, you see parents hide their children. They won't take them out for you to label them. They won't take them to church. Because even at church, the other church members can't understand why the child can't sit still.
Sit down, right.
And it's jumping all over the place. So this discussion is a wide one we need to have across communities, across groups and settings, mosques and churches, schools and what have you. We really need to bring to fore what this is, so that when we see it, we understand the children. We empathize with the parent. We don't point finger at the parent, because they're already struggling as it is. They're really coping with very, very difficult situations at home, and they don't need another person pointing fingers at them.
Right.
Yeah.
Okay, let me go back to Doc. I understand Doc is on the lines now.
Okay.
Hello, Doc. Hello, Doc.
Hi, I can hear you. Loud and clear.
Yes, but we are receiving some feedback from here. Hello, Doc.
Is it better?
No, we're still getting some feedback. Yeah, unfortunately.
Let's try.
Yes.
I was following the conversation.
So we'll try and fix that.
So maybe you can try again.
Yes, we'll try that again. All right. Okay. Let me come in studio again. Because unfortunately we are not getting Doc. Because I want Doc to give us the understanding proper, so that we get to understand. But I'm sure you can also still share something, since you advocate for.
Think to it. So let's take. We are given different kinds of machines to operate. There are some that will turn out working, and there are some that we might not know how to operate it. So we'll label it as not working.
Right, or faulty.
Yes. So that's how the autistic mind is. The brain is different from what we all know, so we might think is what? Faulty. From my education perspective, I would say that they have a different way of learning.
Okay.
They have different way of experiencing things around them. So what we have to do is rather get to know them and see how best we can assist. How does this child learn? If this child is into cars and we are doing numbers, why not do counting of cars? instead of trying to just go straight to the number work.
Yeah.
So the best thing is getting to know how their brains are working so that we can assist them. Yes.
We need to understand. But what are some of the early signs? I mean, Grace, you were talking about having experienced something like that. What are some of the early signs you saw that, I mean, or when people see, they will know that something like that is, I mean, the child has that condition?
So thank you very much for this question. And one of the very first things you would notice is that when you call the child, he or she does not respond to his or her name. You can tell that it is not a hearing problem, because when they're in the bedroom and you're playing a song they like, they will run to that to the sitting room to listen. But when you call them, they don't respond. They have a challenge with eye contact. So there's very limited eye contact. They can't look you in the face like the way I'm looking at you. When you are even talking to them, they tend not to be able to do that. They line up toys on the floor. You see that behavior as well. Earlier on, I mentioned about repetitive actions, either flapping, rocking, spinning. So they have those as well. They like to play on their own. They don't know how to interact with their peer and take turns and so on. So you would have to make time to teach them all these things, because it doesn't come naturally to them. Some of them tiptoe. So instead of walking on their flat heels, you see them walking on their toes all the time. So these are just a few of the very early ones that you would see.
But before you can see a child spinning, then maybe they're around like 2-3 years.
Yes.
Are there some early things that you can see maybe when they are babies, or around that time you won't see anything at all?
Under 1, under 2, you would see, for example, the eye contact.
Okay.
And then a communication delay.
Right.
So the child should go past babbling by 1 and be into single words.
Okay.
So you would notice that they are delayed. But very early on, under 1, it's hard to tell. It's hard to tell because they are at this stage, they are still infants. So it's harder to tell. But between 1 and 3, most of the time you see all the signs. Yeah.
I see. All right. I understand that Doc is on the lines now. Hello, Doc. Hello.
Yes, absolutely. Very important discussion. Can you hear me?
Yes, I can hear you now. Great. All right. So, Doc, I was asking about the early signs.
Okay.
What are some?
Echo better?
Yes, it's better. What are some of the early signs that people should, or parents should, actually look out for in detecting if maybe their child may be having the condition?
All right, so thank you. April is marked as Autism Awareness Month, and 2nd April is actually the day that is celebrated. Theme for this year is Autism and Humanity. Every life has value. So what it means is that we need to understand that even children with so labeled, as it were, with autism spectrum disorder, they have value. The early indicators between 0 to 6 months for a child who is typically developing, as it were, well, would turn his head to the name when called, will match the direction of the mother's head. So the mother is a visible target. If the mother moves, that child moves. And the child will develop joint attention. The mother seems to be paying attention to expression of milk. The child will be looking at the mother, the activity the mother is doing, and will respond to emotions. And those are some of the signs that children with autism spectrum disorder, they may not respond to social cues. Probably you would have to repeat it, prompt them repeatedly before they may respond. They may display minimal response, and they may be very passive, or they may be quieter than usual. And usually some people will say, oh, this is my baby there, he's very quiet too. So that's one of the things that you could see very early.
Right.
Between 7 to 12 months, children with autism spectrum disorder may assume unusual posture. So they may prefer to be called up holding themselves. They may need again more prompts with their names. They may have social touch aversion. So, at this age, when you hug these children, a lot of the children who are typically developing, they like it. They like the emotional support, the hugging. But children with autism spectrum disorder, they may not like those social touch.
Yeah.
So we call that social touch aversion, and it's something that we all need to take note of. Between 7 and 12 years again, they sometimes may show unstable attention, maybe playing with one toy at a time, and may like that toy so much that if that toy leaves his or her presence, may experience meltdown even that early. They may not show any attention to distress to others. So maybe they may have an older sibling who is crying, and a child may want to console the older sibling somewhat, but children with autism spectrum disorder may not show that, and they may lack social smile. Okay, social smile,
Hello, Doc. The network.
and then appropriate facial expression. So, sorry, yes, can you hear me?
Yes, I can hear you. You,
Can you
you
hear me?
talked about
You
social
can see.
smile. What
As
is that?
the lady in studio mentioned, between 1 year to 2 years, that's where a lot more people see a lot of the signs, and you'd see unusual or repetitive movement or posturing, flapping, the child saying words which are, as it were, monosomy. So it's like the same word. There is no in or out. It's the voice is like monotone. Okay, and then sometimes the child lacks showing. So when he needs something, he may hold your hand and take you to the thing and may not be able to say any words afterwards. And of course, repetitive movement and unusual play with objects. So these are some things that you would see very early. Some children may also have joint inattention. So if I'm doing something with the child, I'm buttoning the child's dress. The child is looking somewhere, and you are the one doing the buttoning, or he's doing a scribbling. You can hold the hand whilst he or she is scribbling, but his eyes is not on whatever you are doing.
Right.
And then, of course, the eye contact bit, very important. Is something that we should look at. The child who is not looking at you in the eye is always, is shying away from your face, and this is very important.
Important.
So, in the nutshell, these are some of the initial early signs that you need to pick up. Yeah.
Right. But Doc, at what age should the parents be worried or begin to worry or maybe take action? At what age?
So again, your show is providing a platform for us to talk about this. Elsewhere, children, irrespective of social stature, would have some sort of screening at 6 months. Some would have some screening at 18 months and then at 24 months. And autism spectrum disorder is specifically screened for some children. um, for one of our panelists mentions one of her first child has was diagnosed with autism spectrum disorder. If she has other children, that child, for example, will need screening even earlier than the 18 months.
Right.
But the most important thing is that when you notice any of the red flags, as we've mentioned, you go to the healthcare space. Sometimes the problem is that you go to the healthcare space, the person you meet there may not be very well versed in it, and they give, as it were, false. Will give you false counsel or say, "Oh, don't worry, it will come." And that is why engaging healthcare workers is part of the advocacy drive that we are all trying to and striving for.
Right. Very, very helpful. Let me come in studio now and bring in Grace and Gifty into the conversation. So let's come back to the issue about the stigma. How does that affect the child? Stigma. How does that affect the child and also the parents?
Okay, so for the child with autism, they are not fully aware of what's going on. So for them, they personally they would not notice. But what we the world around them would see is that sometimes they are alienated. So the other children are not engaging them. So they see them all the time by themselves.
Right.
Sometimes they are bullied by other children because they can't speak for themselves, and so on and so forth. And then for the parent side, it's really the some would say it's your fault. When you were pregnant, you didn't do this, you didn't do that, you didn't pray enough, you didn't, you gave too much this and that.
Right.
So
all kinds of reasons.
All kinds of reasons to make you feel. Yeah.
People say that too.
Yes.
And the drugs the doctors gave you, you try to add on some more to get a perfect baby. That is why it has resulted in that. Yeah.
But how has that affected care? You know, I'm sure that could be one of the reasons why people do not take their kids to the hospital to actually go and check. I mean, the early stages. Could that be the reason? Could that be one of the reasons? The stigma.
Yes, the stigma, but also financial reasons why sometimes they will not take it. It depends on which part of the country you are in, and then and then even the healthcare system, like Doc was mentioning. So again, one, is there a hospital close to you,
right,
or where you are to send the child to? Are the health workers conversant with the early signs of autism? Would they be able to give you the right advice, like he was saying? Because a lot of the times it's very hard to tell look the parent in the eye and say, oh, you need to take your child for therapy. Another topic altogether. When you say therapy, it brings fear to some parents.
Right.
I mean, I have an inclusive school, and I can see clearly that a particular child needs therapy support. And as soon as you bring the word, the parent freezes. No therapy.
Right.
It's like some kind of medication you give to the child to, and it's just the one-on-one support the child needs in order to catch up the gap. That's it. And so,
And sometimes, some attest to just speech delay.
Okay.
Yes. When they go to the hospitals, as she was saying, they might not go to meet the people who have the right skills to give the diagnosis. So, give the diagnosis. So then they end up saying that, it's just speech delay. With time, they will speak. But then one thing we have to also pay attention is the social skills.
Right.
Yes. So speech delay, there shouldn't be a challenge with social skills.
Exactly.
So if it's just the speech delay without any other challenges, then fine. But then if they are showing other signs of autism, then we have to move into
right. Okay. Doc, so tell us, what is the process of diagnosis like? How do you guys do the diagnosis?
Hello, can you hear me?
Yes, sir.
All right, great. Just let me touch on where the last speaker left off.
All right.
It's important to note that there is, in the medical parlance, what we call differential. Something that can also look like autism spectrum disorder. So a child who has a sensory integration dysfunction, for example, I mean, the child is not being spoken to, the child is not receiving attention, the child is not receiving love, may come off as someone with autism spectrum disorder because the brain is not being stimulated enough, or the child is exposed to, say, screens very early. So that child can talk to the screen, can relate to the screen better than human interaction. So that can be one of the differentials. A child with a language delay, as one of the panelists mentioned, could also be mislabeled or misdiagnosed as being autism spectrum. There are some children who have what we describe as a global developmental delay. So there's a delay in all the spheres. What they can use the big muscles for, the hearing, there's a delay, speech, there's a delay, the fine, there's a delay, can't pick food into the mouth and all that. So we need to be able to make those distinctions. And then, of course, there are some children who have anxiety disorders, obsessive compulsive disorders, and all. And to even make the issue more interesting is that children with autism spectrum may later on develop all these other concerns, the anxiety, attention deficits, and then obsessive compulsive disorder. How do we make the diagnosis? I think the most important thing is to be able to recognize patterns. The important thing is to take the history from parents seriously and concerns from the school as well. Now, there are several tools that are available. Usually, the tools are more like a screening tool. They are printed, given to the parents. They have to take one to another setting, and this other setting may be a school, a Sunday school, or if the child lives elsewhere as well. So those are the things that need to be filled. And then the child needs to fulfill a criteria. So just like in malaria, you have a fever, you have that, and then maybe we do the test and you test positive. Also in autism spectrum disorder, they are what we describe as scale. So the scale tells that, okay, this child should score, say, 2 out of 4 of someone who has problems with movement, speech, someone who likes or insists on doing something the same way, someone who has restricted interest, someone who is very hyperreactive or reacts abnormally, for want of a better word, to sensory input. So there's a song playing, very low volume, but this child is covering the nose, it's covering the ears. It's because he's interpreting that low sound as it's really creating a lot of issues in his or her brain. So he doesn't want, he wants to blur out the sound. So once you score, for example, 2 out of 4 of the things I've mentioned, then the diagnosis comes up very, very strongly. Sometimes you'd also want to assess the severity of the spectrum. So there is from level 1 to level 3. Level 1 meaning the child will just require some support. Sometimes making friends are difficult for those children, but I mean, it's one of the milder forms. And level 3, the child requires substantive support. Usually those children will have no words or very simple few words. So those are some ways that we diagnose the autism spectrum disorder. Okay. But let me say that when you say someone has mild autism spectrum disorder or severe autism spectrum disorder, really what it means is that the child may have even put in a lot of effort.
Right.
So that effort that child puts in at the back, that you cannot see. So the fact that it is mild doesn't make it any better than severe. All right.
But is it curable? Is it something that is curable, or must be managed?
So autism is unfortunately a lifelong problem. Between the first 5 years of life, the brain has the ability we call increased plasticity. What it means is that the brain can take up new skill, can learn new skill, can learn to cooperate better if you put in the right intervention very early. So that is something that we need to emphasize here. If the intervention doesn't happen early, the child may grow up with other social problems, even frank psychiatric conditions. So the idea is that intervention should happen early, and intervention can happen early only if we get the diagnosis and the screening early.
Right. Okay. Doc. Okay, I think you muted. All right, so let me come in studio. But do you think we have enough support systems in this country for people like that? And I'll start with you, Gifty.
I would say not really. The awareness is still ongoing, although it's better than before. Yes, the news is still being spread, and then as we are creating the awareness, we are still moving for acceptance. It's the acceptance that will bring the action, so that we can accommodate them in our environment.
When you say you're moving for acceptance, what do you mean? It doesn't mean people are not accepting.
Yes, I would say from experiences, even some schools, when you take the child, they see it as work. How, as a teacher, how can I have such students in my class with other students? How will I be able to manage? It's going to be lots of work. We can't cope. And then the other perceptions they have, you can have a teacher asking you that, I have never given birth before. What if I handle such a child, and then at the time that I'm ready to give birth, I also give birth to such a child?
People say that.
They do ask some questions.
Yeah, as if it's contagious.
Yes, but it's not.
But it's not.
It's not. It's just the brain that has developed differently. Yes.
Right. And you talk about our school systems. You talk about the fact that, they want to pay attention to everybody else apart from their child. But do you think our school systems are equipped enough to be able to accommodate all of these people? And you spoke about inclusive education. So let me come to you, Grace.
Yeah. I think there's a gap in our educational system.
Right.
And there's a huge gap there. Today, I can say on authority that we have very limited institutions where we have true resources, inclusive resources to manage children with autism. So we need everyone to come on board, government, NGOs, everybody come on board. The teachers, she mentioned about the teachers. The teachers, we have lots of teachers, but how many of them are trained on, one, even the science of autism, two, how to teach a child with autism, how to set up their class to ensure that a child with autism can learn in the class. So the gap is huge. I mean, I am yet to find one government school where they are managing children with autism. I know we have for the blind. I'm not sure that we have any for children with autism.
So you're pushing,
in terms of resources, we don't have enough.
So you're pushing for inclusivity.
Exactly.
So there are some people who actually push for a specialized school for them. What do you have to say to that?
So it depends on the level of the child. As Doctor mentioned, there's the level 1, level 2, level 3. Some of the children, majority of them, need an inclusive space.
Right.
So they are not aggressive. They don't have these very strong behaviors that make it very difficult to interact with other kids. So for such children, we just need to make sure that we are supporting them in terms of speech therapy, behavior therapy, and so on and so forth. But they can learn.
Okay.
As Gifty mentioned, they can learn. The children with autism can learn. The way they learn is different, but they can learn.
Okay, right. So away from school, or you want to say something about the school?
To add to that, I would also say that some of the challenges they do have is social skills. So we are separating them. How then are they going to develop that social skills? So what we have to do is send them into the regular school so that they can interact with the other children.
Okay, that's fine. Now, in terms of family, how can families begin to really support even mothers who have children like that? What can families do? Yeah.
So first of all, as a family who has just received a diagnosis, there's no need to panic. But they shouldn't wait either.
Okay.
There's no need to keep the child and let's wait and see.
No.
Let's take the child. Let's pray about it. Let's wait on God for direction. Right. Let's go straight for therapy. The earlier the intervention, the better for the child. Right. Sometimes the child is exhibiting one or two things. The child may not be showing all the signs, especially very early on in the age. Whatever it is that is the red flag can be tackled. Okay, we don't need to wait for the child to exhibit all the signs. Be a grown child before you go in for therapy.
Right.
Start the therapy early. At home, speak more to your child.
Okay.
Let there be a lot more language around the child. Repeat and repeat and repeat whatever it is that you're doing, especially when you're doing something that is routine. When they're eating, hold their hands to teach them how to eat them. So don't be in a rush to do everything for them.
Right.
Support them to fend for themselves.
Okay.
Because as you do that, they learn how to take care of themselves. Encourage the children around them to include them when they are playing as well. Yeah. So these are
Right, very good points. So let's talk about communities and communities, churches, the religious institutions. I want you to also speak to them, then I go to Doc.
For community, the church, the schools, everybody around them, I would say that first thing we have to think of is not just persons with autism, but then their sisters, our brothers, our children. Yes, it could be your child's friend.
Right.
So what then should you do? You should first have to accept who they are, be curious about their world, and then get in there and see how best you can help.
Okay.
Yes, let's stop blaming parents for any faults that they've made. They didn't do anything.
Okay.
It's just the brain that developed differently.
Right. Okay.
I just,
before you go,
I want to chip in something about the church, the mosques, and so on. The truth is that these children were created in the image of God as well. They have the right to learn about God. They have the right to build their faith. They have the right to be baptized, to be confirmed, and so on and so forth. And so as a church, as a religious institution, how are we embracing these children? In my church, for example, Christ the King, with the priest formed a Sunday school class specifically for children with special needs.
Wow.
And we have in-house therapists, we have in-house trained people within the Sunday school group who manage these children. So parents don't feel alienated. They don't miss out on church. They can come to church and bring their child to the Sunday school class. So we should have more of these conversations, because the more we are able to do this, the more the community, Ghanaians, would accept these children as a part of us.
Right.
My sister mentioned that the child with autism is not different, or is not sick, if I may say so. They just they differently made. It's like the way we have tall people and short people, dark people. They're just differently made, but they are not less. So we need to see how their brain is functioning and support them accordingly, so they can also be the best version of themselves.
Wow. Thank you very much. Let's Doc wrap up for us. Doc, any final words, and then we can go.
So what can we do more in our Ghana health system? I think that the health system, we need to train particularly community health nurses, those in close contact, to be able to pick up some of these signs very early. The same way we do very well with immunization at specific periods. Maybe we should add questions, especially at the 18 months, some screening questions about autism spectrum disorder, and we might pick these children up very early.
Right.
Midwives, community health officers, we need to all know about using the MChat screening tool. Very simple. Print out to the parent. They take one to another setting for it to be filled. It's brought back. A scoring system is done. The child scores high. It's integrated to the health facility, and then we can move on. And we need to also expand and have resource special units. Again, I mentioned a debate about whether it should be inclusive or selective education. I think inclusive is the way to go for a lot of these children. And of course, the curriculum and exam should make things available for neurodiverse learners.
Right.
We need to include autism services, related services, on the national health insurance coverage, because most of the time, some of the reasons why therapy is unaffordable to most families, so they don't turn up for it. You take Accra, Kumasi, then what happens to the other regions? So it's important we have this discussion.
Right.
On the national level, we need to talk about this national strategy for clear referral pathways when a child is picked up early, because we are talking about screening. So now you've screened, parents know, they've accepted the diagnosis. What happens? Are there clear referral pathways? So these are conversations that we need to have.
Right.
And just to end, I would say that autism and humanity, every life indeed has value. So we should make sure that we don't treat children with autism less than any child. Thank you.
Right. Thank you very much, Doc. I think it's been a very good conversation, and it doesn't end here. Of course, we need to continue to advance it on on our social media platforms and everywhere else. But it's been a very good one. Thanks to my guests for coming. I have in studio Grace Abbey Nkrumah. She's a CEO of Bright Steps International School, and she's an autism advocate and also educational psychologist, specialist, and autism advocate, Gifty Autry, and also Dr. Richard Bright Daniel. He's a pediatrician at the Kolebu Teaching Hospital. So these are the three individuals who joined me. Ladies, thank you very much for coming. Really grateful. And Doc, thanks so much for joining us over the night. All right. And I have some messages here. Let me just read them quickly. This one says that good one. Theophilus King says that on Facebook, and also Eunice Digby says that well done, Gifty. Great topic, and thanks to you all in the studio. All right. So these are some of the messages that came through. Really grateful that you also listen to us wherever you are. That's how we wrap up today on the Business Breakfast on Z101.9 FM. Unfortunately, we couldn't open the phone lines because of how short the time was. But we're back again on Monday for some more interesting conversations. Until then, keep listening to Z101.9 FM. My name is Nitrebi Hammond. I'll see you on Monday. Up next is The Brighter Side with Jeremy Okoria Marco. Bye-bye.